Hey everybody, just a little disclaimer before we start this episode. I'm always learning and growing, and I just wanted to let you know that I get very caught up in very cis binary terms. So I refer to things a lot as she and woman and her, but we all have breast tissue, whether we are cis, trans, non binary. So please keep that in mind as you're listening. I'm learning. I'm trying to do better. You can do better too. So join me in this. Please keep that in mind as I keep saying she and her. She, he, they, z. We all got boobies.
Welcome to Nursing Uncensored. I am here today with Courtney Shihabuddin, and we are going to have a really great conversation today. We are going to talk about Courtney's journey as well as Care+Wear. Care+Wear is a healthcare company committed to inclusivity, providing dignity and compassion for often overlooked patients. They make a healthcare clothing line for often overlooked post-surgical patients who have ports, PICC lines, things like that. We're going to talk today with Courtney, who is a doctorally prepared, board-certified adult gerontology primary nurse practitioner in Columbus, Ohio. She has over 11 years experience as a nursing professional. She serves as a mentor, a keynote speaker, and an advocate for young women with breast cancer. She's an educator and a social media leader. She's respected for her authenticity and relatable content focusing on her breast cancer journey, which began right at the beginning of the pandemic. I can't imagine being diagnosed with cancer at the beginning of this whole mess with COVID. She's also a mom, and if that's not even enough, that's a full-time job by itself. So I'm really excited to talk to Courtney today about her journey, her experiences, and all that she's done. So welcome to the show, Courtney. I'm really excited to talk to you today.
Thank you so much for having me. I'm thrilled to be here. I've been, like I was telling you earlier, just binging your podcast, and I love everything that you talk about and your guests. You make me laugh, and
Good.
I'm so honored. I was kind of fangirling when I got the invitation to come and chat with you.
Well, then it's mutual. I would love you to tell me a little bit more about yourself. You're a mom. That's like a full-time job in and of itself. So tell me a little bit about that first. Moms love to brag. So this is your brag time. Go for it.
I am a mom. I have two little boys. I'm a hashtag boy mom. And I have a 6-year-old whose name is John, who is very smart, but only in the things that he wants to pursue, like Minecraft and some other video game thing that I will never, no console will ever be in this house, but he likes to watch YouTube videos of other kids playing, or adults really playing video games, and
I'm into that too. I like some of these games are so beautiful and crazy. I can't play them myself, but I get it. I get it a little bit.
Yeah. So it's called Skylanders Trap Team or something like that. And he wants
okay.
an
I don't know.
Xbox for Christmas. I'm like, you're 6. Go read a book. So that's a constant battle in our house. And then I have Ben, who will be 3 the end of this month. So and he's the complete opposite of John. All he wants is for you to read to him, and he wants wants to color, and he wants to read books, and he doesn't care about television, and he wants his father to always read him books in Arabic, and they're just so polar opposite, which is crazy because I made both of them, and they could not be more different, you know.
That's cool. Maybe someday they can like teach each other things, like once they're at an age where they're a little, I know, who knows, they'll keep you on your toes either way.
They're essentially the same size, which is crazy because they're 3.5 years apart. And they wear the same size clothes because John is what I call, he's like a little cinnamon stick. He's like a twig. And Ben is like solid.
Nice.
So again, they could not be more different. But now they're fighting over, who gets what Godzilla t-shirt.
So I don't know if this is a good thing or a bad thing. Like, You don't have to shop for two different sizes, but like the battle
No,
continues.
but now I just need two of everything because it's like I have twins, except they're 3 years apart.
All right. So yeah. And so yeah, mom is one hat that you wear, but
Yeah.
you're also it sounds like you have quite the nursing resume as well.
Yeah.
A little
So
bit about that.
I started as an ER nurse. I always knew that I wanted to be in the emergency department. I was an EMT. I started as an EMT when I was 16. And then when I turned 18, I got a job in an emergency department working as a patient care technician. And I decided then that that's where I was going to be a trauma surgeon and I was going to go to medical school. And I got an athletic scholarship to Northwestern and I was pre-med and I got a D in chemistry my first semester. And that
Oh,
was like the end of that. And I was devastated and thought my life was over and didn't know what to do with, honestly, I didn't know what to do. I had thought I wanted to be a doctor since the time I was 5. And I really kind of struggled through all of that until I learned that I could still be in healthcare, but just I went into communications essentially, and I worked in healthcare communications before deciding to go back to nursing school and pursue a second degree. And so I did that, knowing that I was going to work in the emergency department because that's where my heart was.
mhm.
And so I did. I worked in the ED for about a year, and then I started NP school. I met my husband while at work. He was a pediatric emergency medicine fellow. Um, and so I finished NP school. He graduated fellowship and had taken a job in Oklahoma. So I went back and forth for like the last year of NP school, which was stressful. I would not recommend that to anybody. Like
That's a
10,
lot.
yeah, it was like 10 days in
Wow.
Oklahoma and 7 days straight of clinicals in New Jersey and going back and forth for a year.
I
Um,
literally just got goosebumps
yeah,
over my
it was
entire
terrible.
body.
I
Oh,
got shingles. So
girl, for those of you that are like that are not watching this, that are listening to this, the look that just spontaneously came over my face when you said that. Oh, wow.
yeah.
Okay.
Yeah, so
Wow.
it was a wee bit stressful.
A little.
A wee bit, yeah.
Oh,
But then I graduated and we got married. And then I took a job as an HIV specialist in Oklahoma, which I adored. And I was there for about 4 years before we relocated to Columbus. And now I teach full time. I work at Ohio State and I teach in the graduate NP program. So I teach nurses to be nurse practitioners. And I work in the Columbus Free Clinic 1 day a week where I precept medical students, NP students, and PA students. And I love that.
nice.
Um, and then in my spare time,
Oh, all your spare time.
my husband jokes that I operate on a 36-hour day instead of a
Yeah.
24-hour day. Yeah. So in my spare time, I have my social media and my blog and I talk about nursing things. So I provide educational content for providers as well as lifestyle content. So I try and balance that because I like both. And then I have like a mentor. I mentor nurses who are thinking about nursing school, who are nurses, who are struggling with something, who are transitioning to NPs, and they're kind of trying to find their way. And I love that. Um,
So
and
like
it,
the radar in my brain is like, she said blog, you
oh
must find her blog, you must find her
yeah,
blog. So yeah, I'm as soon as we're done, I'm immediately gonna go like devour all of your content.
yeah, it's npcourtney.com. Easy to remember.
Oh, okay. And I'll include that in the show notes so that everybody can
Thank
find you.
you. Yeah.
Sorry, I didn't mean to stall you out there. Keep going.
Oh
Keep going. I
no.
love that, but I love that when people mix like because obviously we're multifaceted people. We're not just nurses. We're not just like our lifestyles, but when you combine the two, like that's so great because all nurses want that. I find that people that write to me, they want to hear about that. They want to hear about how you balance the two. You know, your 36-hour day and all. We all want that. We all want to have our at-home lives. We want to have our professional lives and then time to do the things that we love and want to squeeze in between, you know?
Yeah, my husband joked with me before I started the blog. He's like, "You need a hobby." And I'm like, I don't really have I don't really have a hobby. Like I've never been somebody who quilts or knits, or like adult coloring books don't interest me. He likes comic books. That also does not interest me. And so I was like, what could I do? And then when I was diagnosed with breast cancer, um, I felt compelled to share my story because I was 35 when I was diagnosed. And to me, my experience with breast cancer had been like my mom. And people of her generation. I didn't know any young people with breast cancer. And I really struggled because, as you said in my intro, I was diagnosed in February of 2020. And then the pandemic happened. And so I was trying to, once you get told you have cancer, it's like, get it out immediately, right? Now that it's there, like every second of every day, all you can think about is it's growing, it's going to spread. So
Right.
then the pandemic happened and then everything shut down. And I had to have a double mastectomy. I had a tumor in one breast, and then I had like 50% of the breast tissue in my other breast was precancerous. It was lobular carcinoma in situ in my left. And so I was told the only surgical option was a double mastectomy. And so that was what I was going to have. And it was scheduled for April 16th. And I remember my husband and I watching the news every day after the first case appeared in Ohio. It was March 9th, I think. And I remember watching the news, and just every time it turned on, they were talking about, more and more people were dying, and hospitals across the country were starting to shut down. And I remember it was like the world news, and they had patients at Sloan Kettering in New York whose chemotherapies were getting canceled. And I was having panic attacks because I was like, well, is my treatment going to get canceled? And I went to go see my oncologist for the first time the end of March. And as I was pulling into the parking lot, my surgeon called and said that they've projected the peak is going to be April 12th. And we're going to shut down the James, which is the oncology hospital here. And there will be no more surgeries. So we're going to have to postpone your double mastectomy until COVID calms down.
I'm like speechless.
Well, I I was driving, and it was like tears. Just, what do you mean? He's like, well, I know you have your appointment with your oncologist. We'll just have her put you on tamoxifen. And then when all this is over,
Just. How do you use words like just?
mhm, and then when all of this is over, we'll schedule your surgery. And
And
I
at that time, we didn't know anything.
no,
Know
we knew,
anything
I mean, we
about
thought we did, but we knew nothing, right? So I walk into the building like shaking, alone because of COVID, um, to meet my oncologist. And I told her that this happened. And she was like, we can't do that. She's like, I don't know. First of all, she's like, I don't know if you have spread to your lymph nodes. I don't know, once we know if you have lymph nodes or not, then we have to do genetic testing on them to see what your oncotype is. So an oncotype tells you your specific tumor's genetic propensity for metastasis. And they can't perform that without the tumor.
it. Which means
So,
they have to get to it. They have to
right,
take it.
right,
Right.
right. So she was like, if I put you on tamoxifen, you have a hormone positive cancer, it could inhibit your oncotype results. And we will then have false results, and we won't know, it'll be deflated. We won't know if you're going to need chemo or not. And I was like, well, fuck that. Like, what do we do? So she excused herself, and it was March 31st was a Thursday. She came back about 10 minutes later and she said, your surgery's on Monday.
Oh. Like I'm not even being hyperbolic here. Like I just got chills throughout my whole body. Like I don't even have like a vocabulary or like I'm listening to your story third hand and I'm having like these profound visceral reactions to everything you're telling me, and it's like a 1/100th or a 1/1000th of what I'm sure you were feeling in those moments.
It was,
By the way, are you okay talking about this? Like, are
yeah,
you okay?
no,
Okay. All right. Just
I'm
checking
okay.
in. Just,
No,
just
I mean, I
checking
might
in.
get a little sniffly, but I'm good.
Okay.
Um,
Because I'm getting sniffly. So I just want to make sure you're all right talking about this. The nurse in me wants to protect you. Okay. Thank you for
I
telling
feel
this
the
story,
hug.
by the way.
Yeah.
Okay. Okay, good.
No. Yeah. So I went in, I had my double mastectomy and my lymph nodes came back clean. And then I had to wait a month for my oncotype. And then I had 4 drains, which let me tell you, the Jackson Pratt drains are the most uncomfortable part of any type of surgery that you're going to have. I mean, once your breasts come off, all the nerves are severed, right? So you don't have pain from the actual surgery. You have freaking pain from the drains because they then put these bras on you that the side of the bra is right where the drains come out. And so it's just
So,
constant.
for those of our listeners that are like pre-nursing or maybe are not in the medical field, because we do have some of those listeners, will you describe what a Jackson Pratt drain
Oh
is?
yeah. So a Jackson Pratt drain looks like a grenade. And it's silicone and it's connected to a tube. And the tube is left inside of you during surgery. About 10 inches of tubing they leave inside, and that helps drain additional fluid that could, so when they're doing the surgery, they flush everything out with antibiotics and lots of saline. And so when they close you up, they want to make sure that there's a way for that fluid to escape. So I had, major surgery when during a PPE shortage. So it took longer because the surgeons weren't allowed to have anybody else other than themselves and one nurse in the OR. So no first assist, which for you guys who are medical, you understand what that is. So they had to do the entire surgery themselves with no one to help them. So it took 2 hours longer than it should have. So I was under anesthesia longer. So I was, so anyway, they leave these drains in. To drain any extra fluid that may accumulate because the space that was occupied by tissue is now gone. And so your body tries to fill that space as it heals. And so your body generates all this extra fluid. And so they put 2 drains on either side. So 10 inches of tubing inside and then about a foot of tubing outside. And it connects to this little grenade shaped drain, which is a Jackson Pratt drain. And you squeeze it and then you close the lid. So it creates a suction and it pulls all that fluid out. And the drains themselves aren't painful because like under your tissue where they are, it's really just where they come out of you that hurts. And because you have an opening that's probably a quarter of an inch for each drain, and then they have these grenade type things that kind of they're on a 12-inch string and they can get pulled they can my son jumped on me thinking that mom was fine and like tore the stitch that was holding my drain in
Oh,
place.
oh.
He was 1, so like
They don't know.
he
They,
didn't know,
they
he
think
didn't
mom
know.
is fine.
He didn't know why I was crying. That shit hurts.
Mm-hmm.
And so the drains are the absolute worst thing ever. And they send you home in these surgical bras, which are helpful in that they have, Velcro on the shoulders and Velcro down the middle so that you don't have to lift your arms, because that is painful. But they're not really designed for women who have drains because the band of the bra is directly where the drains come out
Mm-hmm.
every time. And I ended up having to have I had 4 surgeries last year, and 2 of them I ended up needing drains for. So this first one, and then after I had my tissue expander, so after my mastectomy, they put tissue expanders in the cavity where your breasts were, and they fill those with saline to stretch the skin and create a pocket, where an implant will eventually go. So um, after I healed for about 3 months, I had what's called exchange surgery. And that was in August. So things had calmed down from a PPE standpoint. I mean, we still had COVID, obviously.
Mm-hmm.
And so, before my mastectomy, there wasn't even testing for COVID, like prophylactic testing or pre op testing. But in August, there was. So I got my COVID test. I go in, I have my surgery, and it was a breeze in comparison. I mean, I was like on my Peloton within 4 days,
Oh, wow. Okay.
which is probably not a good thing.
Oh.
But he told me I could walk. So I was like, well, I guess what's the difference between walking? It was like 100 degrees outside. I don't want to be sweaty with wounds.
Mhm.
So I'll just sit on my Peloton and just do like a low impact ride. And I did that for about a week. And then 11 days post-op, I had an arterial bleed in my chest. Um, uh-huh, that was awful. And then I had
Sounds like
another
it.
drain. But in the interim, Care+Wear had reached out to me and offered to send me a surgical bra. And so when I came home from this emergency surgery with drains on the side that I had the bleed, I had a liter of blood that went into my chest. So it pushed my implant up above my collarbone.
Holy
And
cow.
it was, there's pictures on Instagram if you want to go back on my feed to
Okay. I will. I do want to see this.
August.
Holy
Yeah.
moly.
And it was like within 5 minutes, I got severe. I thought I had a PE at first, like severe chest pain, shortness of breath, and like that feeling of impending doom. I had that.
Yeah. Whew.
Um, and I couldn't get comfortable. And over time, the implant, it just grew and grew, and it was up at my collarbone. And by the time they got me into the OR, I had a liter of blood that had collected that was compressing my lung, and pushing that implant out. Uh, and so they had to drain it and remove the implant, clean everything out. And it was still actively bleeding when they got in there. So they clipped that little sucker. But it was so unusual 11 days post-op to have that type of a hemorrhage that they made me a morbidity and mortality case at the hospital. Which I get a kick out of. So every
I'm
time
glad you're laughing because my chin is on the floor. Wow.
if you can't laugh,
Right. I get it. Like, you got to have, I mean, and as nurses, we do have that sense of humor. Like, if you can't laugh, like,
right.
yeah. Okay. All right. Please continue.
So I came out of surgery and I had a drain and I just about cried because
You're
I
like, again.
freaking hate the drains, right? So I get home. They didn't even keep my entire length of stay in the hospital. The ER, the OR, and PACU was less than 6 hours. It was incredible. I lost a liter of blood, and so that was a lot of blood to lose.
Did they transfuse you? Did they?
No, so I had like symptomatic anemia I couldn't go. I would get short of breath going up 2 stairs for about a week, but I was okay. I was all right. But I came home and I was like, oh, Care+Wear sent me this bra.
Oh.
It has a hole in the band that you can put your JPs through, so that there's an opening, so that area is not like right on the band.
So you don't have like a giant elastic band
So it
shoving against
doesn't
this
freaking hurt. Yeah.
and rubbing
Oh,
and
yeah.
like,
It was the best thing ever. So, for the 10 days or 14 days, I don't even remember, that I had this drain, I wore this bra every day.
thank you,
Every day.
Care+Wear.
Yeah,
Like,
thank you, Karen.
truthfully.
Seriously. And I wish that there was some relationship between reconstructive surgeons and Care+Wear, because these bras, like, women who have mastectomies are always going to have drains, right? You're removing somebody's breasts, there will 100% be drains. It's just a question of how many. I had 4. It would have been really nice to have that little pocket to not hurt so much. And at least I got to take advantage of it for my unexpected emergency life-saving procedure.
Because
So that
as
was,
women, we all know that bras kind of suck anyway,
oh, they absolutely,
without extra holes and sutures in your body.
yeah.
Yeah. So, yeah, very nice.
I'm blessed now that I don't have to wear a bra if I don't want to. But I hate bras. That was one of the best things about getting cancer. It was like, no more underwires for me. My surgeon said never to wear one ever again. It was like permission.
I mean, if you gotta find like the silver lining of the dark
Right?
cloud, like there's one, I suppose.
Yes.
Yeah.
There's one. And, I have like high perky-ish type breasts,
Mhm.
now.
Yeah. I
Yeah.
mean, find the good things. I mean, really, like I'm
I
glad
try. I'm a
you're
glass half full kind of girl.
you're alive,
I am alive.
you're not yeah, you're not yeah, there are definitely things to be grateful for here. So,
Yeah.
I'm glad you're alive. I'm glad I'm talking to you. I'm glad that you had a bra that didn't make you want to scream in pain. So, these
Yeah.
are all good things.
It was, yeah. And I mean, they make so many other like healthcare adaptive clothing. I didn't have to go through chemo, thank goodness, because my cancer was caught really early.
Mhm.
But they make, shirts with zippers around the collarbone on both sides for easy port access so that chemo patients don't have to take their clothes off. They can just unzip for easy port access, which I
Mhm.
think is so humanizing, and you know, not having to change into a hospital gown every time you go
Mhm.
for chemo. I think that in and of itself is just one less awful thing that people who are going through chemo have to do,
And for those that don't know, like oftentimes when you're receiving anytime you're getting um really not just with chemo, but any kind of drugs that are hard on your veins, anytime you're getting medications that you're getting for long periods of time, like for my patients, it's even when they're getting antibiotics that they're going to need for weeks or months at a time, any kind of chronic medications, anything that's going to like really be hard on your veins, anything that's going to require you get IVs over and over and over and over again. We do PICC lines and tunneled ports. I mean, they're like subclavian, so they're like below your collarbone, above the breast line, and they're like under your skin. So, for those of you that are in video, I'm kind of pointing to the area. So, if you're wearing a t-shirt, like you're wearing a standard t-shirt where the collar is like right by your collarbone, you can't have an IV. You're stretching the hell out of your shirt. You got to put on a hospital gown if you're going in for outpatient procedure. Like, who wants to wear a hospital gown if you don't have to? Like, even if it's outpatient, you don't want to have to take off your clothes. It gets cold in these rooms. Like, it just sucks. So, it's nice to have something that you can like unzip something, fold the flap down, because they take these ports that are under your skin. They take a giant needle, they put it through your skin into this port, and then they can access your it goes into your veins, into your heart, wherever, and then they can give you the medications, the chemo, whatever it is. So yeah, that's like the quick, super dumbed down version of how
You
of
did
how
great.
ports
No,
work.
you did great.
And then with PICC lines, it's usually like somewhere on your inner arm, the like soft, tender part of your arm. It goes up, through your vein, or, your vein, and it goes right in and sits right at the top of your atria, like right by your heart. And they can give you medications. They drop it right into your heart. But then you've got like usually two or three lumens, like two or three like dangly things hanging off the inner side of your arm. They get caught on things, people see them and they're like, "Ooh, what's that hanging off your arm?" And you don't want to talk to every damn person at the grocery store about your PICC line for your treatment. Like, none of your damn business. So, yeah, it's nice to have something that you can either access or cover and hide. So, yeah,
Yeah.
that's kind of like the long and short of ports and PICCs.
So, I mean, I had Lyme disease when I was in 8th grade. And the summer before
Ooh.
9th grade, I ended up needing a PICC line for long-term antibiotic therapy. And so I went to a new school for high school. I went to an all-girls Catholic school with a PICC line in my arm on the first day of school, being the
Oh, and high school girls, mean girls is a term that we use for a reason.
so
Because
actually, I mean,
were they nice to you?
they
Did you get
were.
nice girls? Okay, good,
I
good.
did. I mean, the girls I went to high school with, I'm still friends with many of them, and we
Okay.
have great relationships. But I had to wrap myself with an ace and like get the lumen to stick out just the right way, but not so that it was flopping around. And having something like these PICC line sleeves, would have been really helpful and not as embarrassing as a new girl, a
Mhm,
freshman in high school.
mhm.
So
When you're insecure about every part of yourself.
yeah, and you're meeting all these new people and you're wanting
Mhm.
them to like welcome you into their social
Not to
network.
mention that these like lumens, they like that's the
Yeah.
tender part of your arm.
Oh
They
yeah.
stick in your arm. They create indentations. ace wraps. I mean,
Yeah.
come on, wear an ace wrap on any part of your body for 8 hours a day and
Not,
tell me that that's not uncomfortable.
no.
Like having a small, tiny
Well,
snake
and I mean, you still
going
have to
between your
wear it when you sleep because you don't
right.
want all that lumen in your sleep, man.
No,
Whoo!
yeah.
Good
So
thing it's going
basically,
right
it's a
into your
pain in
house.
the ass all the way around in
Yeah.
every direction. Yeah.
For all of the things, right?
Yeah.
The drains, the lumens, and the ports.
Mhm.
They're all assholes.
So
But yeah,
it's about comfort, it's about safety, it's about like privacy. Maybe you don't want to explain it to
cons-
everybody. Maybe you don't want people knowing.
preserving your modesty too.
Right, absolutely, absolutely. So there are so many reasons why this adaptive clothing is important. And I encourage people that are having maybe a hard time picturing what we're talking about, go to the Care+Wear website and take a look at these things. Because some of you may look at it and go, oh, that makes sense. That makes perfect sense.
Yeah.
Um, so talk a little bit more about just kind of how I know that you're a nurse and you're a patient. And
I
sometimes this is good because we understand a little bit more, but sometimes this is bad because we understand a little bit more.
no, it was terrible for me. And I think it's because being being an NP and being the person who's coming up with the treatment and executing the treatment for your patients, you then have access to all of these resources for researching the treatments, right? And so I was in for 6 weeks after they told me I had cancer until I met my oncologist who actually told me what they were going to do for me. I had no idea like what my staging was. Um, if I knew that I was hormone positive, ERPR positive, I knew that I was HER2 negative, which is specific testing on my tumor, which if you're in the cancer community, you'll understand, but um, different if you're hormone positive versus hormone negative, your treatments are going to look different and your cancers may be more or less aggressive. And so all of this just was compounding. And all I was doing was spending hours researching on the National Cancer Institute and up to date and going through treatment protocols and being like, well, if this is that, then this is how many rounds of chemo I'll need. And if it's this, then I'll need chemo and radiation. And I was losing myself.
Mhm.
And my husband, so I cope by talking it out like this. That's why I started sharing on social media because it was cathartic for me. My husband is a physician, right? And so he knows more than I know, but he didn't want to talk about it until he knew what it was so that we could come up with a plan, which I respect, but did not help me at all. It actually made it worse because I felt like I couldn't share with him. And every time I would try and bring it up, we would just fight because he was like, we have a 1-year-old and we have a 5-year-old. And how are you going to, like, who's going to take care of the kids? Because we have no family and there's a freaking pandemic and I'm an ER doctor. So I can't just not go to work to take care of you. And let's just wait until we know something. And me, I was like, I have cancer growing inside of me and I need to know exactly because I'm type A. I need to like map it out and I need to know what I'm going to do when and what the side effects are going to be so I can prepare. So in that regard, we couldn't be more different. And so I turned to social media because I could share openly. And I found a community of other young women with breast cancer, which honestly, I didn't know. I mean, in my mind, being a healthcare provider, I knew it existed, but I didn't know anybody. And it's actually a pretty large network of really empowered women who are kicking cancer's ass together. And also, like, I'll come kick your cancer's ass if you need it. Like,
Mhm.
they are so strong and interwoven together and supportive, and they advocate and um, they don't take BS when it comes to not outsiders in the community, but like people who don't know, who say things like, if you're sharing about your mastectomy, like, how could you share that? That's disgusting, or sometimes
Get
it's like,
out. You
get
don't
out.
talk, go.
Right. you
Mhm.
know, like learning to love your scars and
Mhm.
making a decision for some women to stay flat and talking about revisions and all of the things that come along with that. Without this community, I wouldn't know a lot of the questions to even ask. And I'm a healthcare provider,
Mm-hmm.
you know? So getting that experience and having those communications, it's hard. It's hard when you are the provider and you have access to all of that and the things. I almost kind of wish that I was a lay person.
Mm-hmm.
But I also know that my providers treat me like a provider, and I think that there's such respect there. And I wouldn't change that, they know that I know. And so they don't dumb it down. They tell me exactly what's going to happen. Like when I had my hemorrhage and I was terrified, I went into the ED hunched over in a wheelchair, and the triage nurse was like, "You're having a panic attack, honey. You're okay." And I was like, "I'm a cancer patient who's freshly post-op, and I think I have a PE. Like, my blood pressure of 180 over 110 isn't because of a panic attack. My heart rate of 167 isn't because of a panic attack."
So I just want to interject one thing, and this is for the benefit of all nurses in patient care, whether it's outpatient or inpatient. As someone who has a long-term history with panic attacks, when I have a patient who is having a panic attack, I always have good results with this. I usually go into my patients and I say, I too have a history of panic attacks. The number one thing I'm not going to tell you is that it's okay, because it is not okay right now. What I am going to tell you is I'm going to be here with you, and I'm here with you. Okay. I never say, you're okay. Because it does not feel okay. It is not okay. So, anyway, I just wanted to say that.
Yeah,
Never tell someone having a panic attack, you're okay. They are not okay. They do not feel okay. Stop saying that shit to them.
right.
Okay, sorry. I just had to, that is my
Oh,
pet fucking peeve. Do not
oh,
tell them. You may know they're going to survive it, but in that moment, they are not okay.
no. And
Anyway,
I mean, I certainly was having an element of panic, right?
yeah, but that's because your
My
chest is
implant was
filling
like,
up with fucking blood.
my implant was over my clavicle. Like there was clearly something wrong.
This is the
And
time when you panic.
I mean, like literally the only way that I could breathe was if I leaned
Was in
over
tripod position. Yeah.
because of gravity, right?
Yeah.
And so they're like, "Can you sit up for your blood pressure?" And I'm
No, no, I cannot. No. Yeah.
yeah.
Okay.
And then they finally, so the nice thing about our hospital here at Ohio State is that their emergency room has an oncology section. So I got taken back into the oncology section, and the resident who came in the room actually had just gotten off of a rotation with my husband in peds.
Okay.
and,
Hello, Mrs.
right. And so it was like, I feel like this is not a panic attack. And then she took one look at me and she was like, "We need to call surgery," and I had called.
Thank you.
Yeah. And they're like, they're getting ready to give me a CTA to check for a PE. And I'm like, I thought it was a PE, but
But my implant is up here. A PE would
now
not
I
do
think it's
that.
not. Right. Right. And so that my attending surgeon, actually, it was a Saturday. He came in, he held my hand as they put me under. He told me I was going to be okay. I mean, I couldn't, granted, he should have clipped the freaking the freaking artery in the first place and
Yeah.
not just cauterized it. Um, but he came in and he fixed me. And so, now I'm fine.
Yeah. I'm glad. I'm
Yeah,
very
and
glad.
I will be cancer. I have the best cancer-free anniversary. It is Cinco de Mayo. So
Hey.
every year, that's the day that my oncologist told me that I was cancer-free, that I didn't need chemo. Cinco de Mayo. So,
Viva la Courtney.
right? So every year on Cinco de Mayo, I will have a party, and it will involve margaritas and tacos and no cancer.
Excellent. I will have a taco every Cinco de Mayo on your behalf from here on out. Yeah, and I am like tacos are so near and dear to my heart. Mexican culture in general. So
You'll
yeah,
have to like boomerang it and tag me on Instagram.
I will do that. I will do that. So let's talk. You said that one of the reasons that your treatment went so well and they were able to like get it in one fell swoop was because you detected it so early. Will you talk a little bit about how did you catch it? Like, was this self breast exam? Like, what all happened? Talk us through this.
So my mom is a 3-time breast cancer survivor,
Go
three
mom, go mom, beat its
not
ass.
recurrent, like new growth breast
Oh,
cancer.
she.
Yeah. And my dad's sister is a 2-time breast cancer survivor similarly. And so I'm an only child, so I don't have siblings to, say, well, we all have breast cancer, whatever. And so we've all done genetic testing and we're all negative for all of the genes that we know of that cause breast cancer that we've identified. But I have an incredibly strong family history, right? I have it on both sides. I have multiple recurrences. And when I was 24, I found a lump and I went to my gynecologist who, with my family history, at that time, my mom had had breast cancer twice and my dad's sister once. So it wasn't as intense, I guess, of a family history as it is now. But she sent me for a mammogram, and being a 24-year-old with a mammogram, you have incredibly dense breasts. I actually had a breast reduction when I was 18. So my breasts are like a nightmare for any radiologist just because of all the scar tissue.
Mhm.
But they actually found something on this mammogram, which was different from the thing that I felt that was concerning. And so they said I needed a biopsy. And so I got a biopsy and it turned out it was a benign fibroadenoma, which is just, it's a benign finding, but it's with my history concerning. And so the radiologist recommended that I see a breast surgeon just for monitoring. So I lived in New Jersey at the time. My mom received her treatment at Sloan Kettering, and she pretty much insisted that I go to New York. So I did. And I had, they followed it on ultrasound every 6 months for 2 years until they decided that it was stable in size. And then the breast surgeon would do an exam and make sure that she felt it was stable as well. And then when I moved to Oklahoma, my my OBGYN actually said that the university had a high risk screening program and would I be interested in participating? I was like, hell yeah. So that involved, you get imaged twice a year. So you get an annual MRI and you get an annual mammogram, and they're spaced 6 months apart so that you're imaged every 6 months. And I did that all through my time in Oklahoma. Everything was, I didn't need any more biopsies. They just continued to follow everything. And then when I moved to Columbus, I was pregnant, but also adamant that I needed to get into a program. And so we did ultrasounds while I was pregnant, just screening ultrasounds, which are not as evidence-based as other types of techniques, but that's what you do when you have a pregnant woman who's high risk. Um, and so then they started MRIs when I was postpartum, and they had been normal until this February. And I went in for my MRI and I had to wait a really long time, which was unusual. Normally the high risk doctor is like, you're in and you're out, and she's on time. And I waited in that room for an hour and a half.
Oh my God.
And she came in and she said, I'm sorry, Courtney, you're going to need bilateral biopsies. And I was like, come again? What? And she didn't bullshit me because she knows I'm an NP. Like, so
Mhm.
she told me, she said, you have a mass on your right side that's 2 centimeters. And it has a significant area of enhancement, which means that the contrast from the MRI was, it lit up around that mass. And I had a very large area of enhancement on the left breast that was not on any prior imaging. So 6 months before that, when I had a mammogram, there was nothing there. And a year before that, when I had an MRI, there was nothing there. And now I had a 2 centimeter mass in my right breast. So they took me to ultrasound and decided that the one in the right, they could do an ultrasound guided biopsy, but the one in the left was too nondescript to do a biopsy. It was just, there was no mass that they could get to. So they did an MRI guided biopsy. And the mass on the right, I went back a week later for. you know, when you have an ultrasound, they like the screen is by your head and you can't really see unless you're
Mhm.
like
Yeah. I
neck.
hate that. I want to
I hate
see.
that too, because I mean, I can like I could see some stuff, you know, I'm
And
not
even if I can't understand, I want to
right,
see. I want to see.
right,
What are you doing? Yeah.
right. So when I came back for the biopsy, the radiologist had to be able to see while he had the probe. So they put the screen at my feet. So the second the tech put the probe on the tumor, I had a vasovagal syncope because I saw it and I knew it was a tumor. Like I knew it was bad. It was just, it wasn't circumscribed. It wasn't hypoechotic. Like
It
it
was
was,
just ugly looking.
it was like, you know, like I don't know how to describe this in words, but it looked like it was invasive. And that's
Mhm.
exactly what it was. Invasive lobular carcinoma, you know, and it had like little
Like
webs.
fingers
Yeah,
almost. Yeah.
it was just
It's not perfectly round for
no,
those of you who don't know like they tell you when you're looking for like cancerous things, like even moles, they're
right.
not perfectly round, the colors uneven, like they don't look pretty. Like
No.
they look ugh. Yeah.
No, and in contrast, like my fibroadenoma was perfectly round and it showed up on ultrasound black, meaning it was filled with fluid. So it was hyperechotic. That's what that means.
Mhm.
And they just measured it to make sure it wasn't growing. And this was like all different shades of gray, meaning it was solid, not filled with fluid. And it was, you know, invading the surrounding tissue. So it was not round. It was not perfectly circumscribed. It was just like really angry looking. And when I saw that,
You passed
I
out
I passed out.
because you're like, oh shit.
Oh shit, I have cancer. And I came out and told my husband that. And he was like, well, I'm sure it's not.
And
Let's
you're
just,
like, Just hear me. Just hear me." Yeah.
yeah. I mean, he eventually, like, I described it to him. And I mean,
But your
he's
husband does
ultrasound
want
certified.
Yeah, but your husband wants to have some form
Right.
of hope
Right.
and positivity
Right.
and love
And,
and
you know, his sister and his mom are both survivors as well. So it's not like, you know, breast cancer hasn't touched our families, you know. But I was 35, you know, I was young, really young. And the scary thing, you know, I couldn't feel it. It was 8 centimeters from my nipple deep. So you were never going to feel it until
Mhm.
it was huge. But you know, 6 months prior, there was nothing there. So in 6 months, it had already become 2 centimeters. And I think about this, and this is part of the advocacy work that I do, that if I didn't know to be in a program like this, or if I didn't know that I could go to my doctor if I felt something and get it checked, if I waited to get a mammogram when I was 40, I could have been dead. Like
Mhm.
I may not have even made it to 40.
Right.
And that is mind blowing to me. And so for that reason, I advocate like hell for young women who
Mhm.
have any, I mean, in it from an educational perspective, like I teach nurses to become nurse practitioners. So when we do women's health and we have our day when we have like medical models, people who get paid to be patients so that we can practice on them doing pelvic exams and breast exams, I tell them that I was diagnosed with cancer at 35. And I make sure that they don't leave there until they can do a really good comprehensive breast exam. And
Mhm.
they will go out there and then do those on all of their women's well visits, because that is how you catch
It's
early
life
breast.
or death,
It
literally.
is,
Literally.
you know, and so I use my voice, I use my job, I use my platform. I mean, it's woven into everything that I do professionally, because this is me, you know. And had I not been screened, had I not um advocated to be in a program like this, or you know, say I had felt it, had I not gotten it checked, where would I be? I mean, I could be stage 2 with lymph node involvement or chest wall involvement, or stage 3, or God forbid metastatic by the time it was caught, you know. um and I don't want that for people like me, and I want my students to catch it early, you
Mhm.
know. I don't want that for other young women. and And through the advocacy efforts that I've become involved in, I've met plenty of other younger than me women. I'm talking like 26, 27 and pregnant who have been diagnosed, and
This
it,
is no joke. Cancer does
yeah,
not give a shit how old you are. But there are, some healthcare providers out there, insurance companies too, will be like, you're too young to have a mammogram. I don't give a shit. Give me my mammogram. I have a
right.
history, and I have a very good friend who, is status post chemo and radiation, who is also very young. She has a family history. She is, God bless her, she's loudmouth. She knew to advocate for herself.
Yeah.
And because of it, she's alive. She's had mastectomies, and I love her to death because she was not someone who was just like, oh, you said I'm too young. Okay. Like, she was in there being like, no, I found something. I have a history. Listen to me.
Yeah.
And it's scary to do that because we still in a lot of ways have this like hierarchy in our culture that like, doctor said so. I should listen to the doctor. They know, but you know what? Doctors are human. They don't learn everything. They are constantly learning. And same with nurse practitioners. We are constantly learning. We need to have that patient advocacy bit as well. But patients need to learn to advocate for themselves. And that's just not something that we're always taught to do. And so I think it's really important that we as nurses, as nursing students, that we learn that advocacy bit early because it can be the difference between saving somebody's life or even just having them not have to go through, like you said, chemo, radiation, dealing with like things spreading. Like it can be so dangerous. I've lost really good friends to cancer that fought like hell because it kept coming back. And what would have happened if they could have had that caught earlier or had more aggressive treatment earlier and down the line? Like it can make such a difference. And so that advocacy work that you're doing, who knows how far that spread? Who knows how many lives you've saved by creating that network of people that are going out into their jobs with that strong, solid foundation of advocacy. Something else that I wanted to say regarding this network of women online that have become this like network of support for other women. I have a close family member that has autoimmune illness, and it's a very rare autoimmune illness. And she also found a community online of people not only that are strong advocates for each other, but they often find themselves educating their healthcare providers because this autoimmune illness is so rare
Mhm.
that oftentimes the doctors don't even know a lot about this illness. And so these networks of people are educating themselves worldwide because, there are so many people that get this diagnosis and they're like, it's not even in a book.
No, right.
And so I encourage people, don't just poo poo away those online networks of people because those can be some powerful networks. These people have spent their whole lives educating themselves. Like even my cystic fibrosis patients, they educate me and I listen to them because this is your life. Like
Right.
you've spent 25 years educating yourself about this. I've spent 5.
Right.
So I think that those are really important points to touch on. So I'm glad that you were able to advocate for yourself so strongly and that you're continuing to do so because this is no small piece of work that you're doing. Um, I think that the mentorship is such a huge piece. And I know we've got more to talk about, but while people are listening, I want you to plug your social media so that people
Yeah.
can find you. So do that again, and we'll do it again at the end as well.
Okay. So you can find me on Instagram at np.courtney. You can find me on my blog at npcourtney.com. And that's where all of the information about mentorship and the cheat sheets, which I call practice guides that I have created, are available as well for other practicing or student NPs. Just little pearls that I've put together over the years.
Yeah, these are good. I love things like this. I'm going to find these for myself as well. Something else I want to touch on before we start to wrap up here. You are an ambassador for the Care+Wear company. Will you talk a little bit about your relationship with them and how people can find Care+Wear products? And
Yeah.
then, and then people can go find that as well.
Yeah. So, like I said, after my surgery, Care+Wear reached out to me and asked if they could send me a post-surgical recovery bra, and asked if I wanted to be an ambassador with their program, which just meant that I shared about my experience. They offered me a discount code for my followers, which I believe is NP Courtney, but I'm not
Double
100.
check that. I'll put it in the show notes so
Okay.
that people can find that.
And so then I just, I share about my experience, really. It's all authentic and personal. And, while I may be on the other side of it, who's to say that I couldn't have, God forbid, knock on wood, something down the road? I mean, at this point,
Let's hope
actually,
no.
my implant, my right implant has flipped. So it's upside down. So I'm a little bit lopsided at the moment. And I have, we do self-exams. So they tell you if your cancer is ever going to come back, it's going to come back right superficially, because you're talking like dividing tissue from skin. It could come back there, or it could come back in your chest wall and you'll never feel it because you have an implant, right? So I felt like a pea-sized mass when I was doing an exam in the shower, just in the skin. And I lost my freaking mind, because I was like, oh, great. I'm not even a year out and I have a tumor. So I went to my doctor and he's like, actually, that's the port where they fill the implant.
Oh.
It's right.
It's like, tell a sister this, will ya?
Well,
Please?
so they're not supposed to flip.
Got it. Okay, so this was like a weird, like,
But of course it's me. I'm always the one
you've
with
got a
that.
breech implant
No,
or
like
something like.
I go like the arterial bleed. I'm the 1%. I went on vacation in Hawaii and got appendicitis. Like who does that happen to? Like I have these weird vasovagal syncopes all the time. Like anyway. So
Are you trying to get in a medical textbook? Is that like really what you're trying to do? That you
so of course this would happen to me. So I actually need to have another surgery to flip it back, because we have been unable to manually flip it, which is like when you're in nursing school and you do OB and they teach you about
the Leopold
versions.
Oh, yeah.
For
Okay,
a breech baby, like it's what you're trying to do. You're trying to do a version on a foob or a fake boob.
Foob.
A foob. It's comical. And so it was unsuccessful, like many versions are also unsuccessful.
Can you stop being abnormal, please? Can you just
Can you behave? Like tell my body, behave. My husband actually tells me that all the time. Like when I had to have a C-section for my second child, I'm very sensitive to epidural anesthesia, and it took them 45 minutes to get me ready to cut. And so my husband is in the bunny suit waiting 45 minutes, and he comes into the OR finally, and he goes, Courtney didn't behave, did she? No, her pressure
like,
kept
listen,
bottoming out, and we kept having to revive her.
Listen, doctor husband.
That's what he tells me. Courtney, tell your body to behave. I'm like, behave.
It has a mind of its own.
I can't control it.
Learn this? Have we not learned?
Does what it wants. It's like a big fuck you, man.
You know what? If a lopsided boob is the worst you have to deal with right now, we'll accept it, right?
Right. It's all right.
Well, you have quite the story. I really appreciate you for telling us all of this. This is not the easiest story to tell, and you've been very open with us. So I appreciate this. I know my listeners appreciate this.
Yeah.
And it's really difficult sometimes to tell these stories with humor, because they are so difficult and they are so personal. So on behalf of all my listeners, I know there's somebody out there that's going through some shit right now that they're like, okay, I can deal with this. I can take a breath. I can make it through another day. But I can totally understand. Like, I've talked to people before that, like, after a diagnosis of whatever it is, they're just like, just fix it. Just get it out. Just do it. Just fix it now. Just right now. And so I'm really glad that to hear when you were talking about like we might have to postpone. And then they got you in on Monday. Like, my whole body just was like, oh my God, the stress and so then there's like the relief of like, okay, they're doing it Monday, but then there's also the like,
shit.
oh my God, I'm having fucking surgery at like 2 days,
I have no one to take care of me because we have no family here, and my husband
and it's a pandemic. Like, The stress of all, girl, I just want to reach through this camera and like give you a big hug.
I appreciate it.
Also, I want to give you a big hug because that sweater that you're wearing looks like the softest thing ever created. And I've just been like looking at the way your collar is folded over. Those of you not watching the video, like she has like the softest sweater ever created on, and I've been jealous of it this whole interview. So, yeah.
I mean, if I could tell your listeners one thing, it would be to check your breasts.
Always, yes. And when is the best time? When is the best time of the month for those that menstruate?
So it doesn't necessarily matter. You just always do it at the same time.
Got it. So you get to know.
And I'm a big I share often. Feel it on the first, right? So on the first of the month, you feel them. And you, so it's a lovely trending hashtag. If you guys ever want to check it out, it's a bunch of mostly breast cancer survivors advocating to non-cancer patients to feel your breasts on the first every month. Get to know them, get to know what's normal for you. And if you feel something, say something, you know, get it checked.
And it is so much more important for you to know what your breast tissue feels like than for a doctor to do it. Because you can get your annual exam, they touch them once a month. They don't know what your breast tissue feels like.
Right.
And those that identify as male or those that do not have typically female breast tissue, you should still be feeling your breasts.
Absolutely. Breast cancer does not discriminate. Men get breast cancer
breast
too.
Tissue is breast tissue. Be touching those boobies, people. Like, do it.
Every month, feel them on the
every
first.
month, feel them on the first. So it's incredibly important, and it can literally save your life. And who doesn't like to touch their boobs? Touch your boobs. Your boobs will thank you.
Feel them up,
feel them up. Feel your boobs. I want to thank you again for taking the time to join us. I'm sure everyone listening has had a good time. We've had some laughs. We've had some tears. You gave me goosebumps more than once. I'm going to include everything we've talked about in the show notes. We're going to have links. I'm going to link to your site. I'm going to link to the Care+Wear site. I really encourage people to go check that out. And I would love to have you back in the future. We'll find something to talk about. You're an NP. You've got 11 years experience. It's enjoyable to talk about you. You've got 2 kids that sound like they keep you on your toes. You've got a doctor husband. It would be really fun if you could like convince him to come on the show.
Oh yeah, he'd love that.
That would be great. Okay, so we got tons in the future to talk about. I'm really grateful that you came on and talked to me. And yeah, this has been great. So
thank you for having me.
Yeah. Anything else you want to add? Or I mean, we've covered so much.
If you want, follow me on Instagram at np.courtney. I'd love to see you and chat with you. I always respond to all of my DMs. I'd love for you to say hi.
That's awesome. Well, and as we close every show, I always wish everybody happy nursing.